Okay, hello, everyone. Welcome into the space, and also thank you for your patience as we work through a couple last minute technology glitches. My name is Ashley Singleton, and I am a senior program manager with the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, or NTTAC for short. Before we get started, I wanted to point out just a few features to help you experience this session. There is live English closed captioning available. If you listen to the orientation, then you know that you navigate to the center of the event page, and in the middle navigation bar, there are emoticons, there's raised hand, and then there is a closed caption button. When you click on that button, it will allow you to see live English closed captioning. For those who would like to experience the session in Spanish, the instructions on how to access the Spanish translation is there on the slide. Okay. And also, I would like to welcome Jasmine, who is our ASL interpreter for our opening, and she will also have a colleague of hers joining her to support that. Again, I want to say welcome to the NTAC community and to the 2023 System of Care Summit. I'm so excited that so many of you could join us today. We're going to take a very quick, what I call a walk around the block, and explore our virtual community and some of the key features and icons together. This is going to move very quickly, but don't worry. We have the orientation that is available on the platform. So if you navigate over to view schedule, and then a pop-up will appear and it says Air Meet Orientation. It's the first item on the session schedule. And beside it, it says Watch Replay. That's where you can watch this orientation over again if you need to catch some information that was missing. All right, so on the center of the reception page, each wheel has a hyperlink to more information. If you were to click on the Summit Feedback Survey, which is the green wheel in the middle there, then you would be taken to a new tab with the survey. This is where you can provide us with feedback on your experience with the summit. It's also where you complete the survey to be eligible for your continuation education hours, or CEUs or CEHs. So there's also a space there, the networking lounge. And this is where you can visit the networking lounge at 2 p.m. Pacific time or 5 p.m. Eastern time today. If you were to join that networking lounge right now, there's no one there because we haven't quite started. So when it's time for the networking lounge, that is where you will go to navigate to that space. In the top right-hand corner, you will see several icons for the entire event. You can update your profile by clicking on the icon that has your initials and your name underneath it. You can also change the language that you experience, some, but not all of the system icons. So by clicking that square with your initials, you can, again, update your profile, change your picture, select your interests, and then also change how you experience some of the icons and the language you experience it in. Okay, next to the your initials icon or your profile icon, you can keep track of all summit announcements by clicking the alert bell. And next to the alert bell, you can keep track of direct messages that you send and that you receive by clicking on that chat bubble icon. Okay, for this next one, I'd like for us to do a really quick exercise. I'd like for everyone in the room right now to click on the icon that has two peg people overlapping each other. When you click on that bar, what I'd like for you to do is type in my colleague's name, Carrie. I'm sorry that font is really tiny, but her name is Carrie, Kari. As you're typing that in, you'll start to see the number of profiles slowly begin to dwindle down until it's just her name and her image left. And if you were to click on her image, then you'll see that her profile shows up, but there's also a place where you can send her a direct message and you can schedule a meeting with her. So let's say that during this session, someone says something really interesting and you want to connect with them later. You can look for that person's name and then send them a message. Hey, you want to connect later? Or you can schedule a meeting with them and they'll have the opportunity to accept that invite. The meetings happen within the AirMeet system, so it won't direct you to some other location. Okay, so next up, we're going to move this from a walk to a jog. I'm going to move us a little bit faster through these icons. But again, you can watch this orientation later if you like. So next to the people icon that we just clicked on is the event feed. Think about the event feed like a social media timeline. Here's where you can leave messages and comments to all of the event attendees. So how about we do another quick exercise? What I'd like for you to do in that event feed is to answer this question. What's your favorite beverage? Is it coffee or tea? So I should start seeing some responses in the event feed. Coffee or tea, what's your favorite? And I'm seeing some responses, so folks are in the right place. Awesome. Kelly's in the right place. Heather's in the right place. Megan's in the right place. Great, good stuff. All righty. So what you can also do is you can hover over someone's message, and then as you hover, and let's, I'm going to politely ask that we can. I see somebody put juice. So we can stop answering that question. So let's stop answering that so that the feed kind of slows down. All right, thank you. All right, next up, what you can do is you can hover over someone's message. And I already see that some folks have done that. You can like a message. You can reply to a message directly. And if you click on the three dots alongside that arrow, you can also send a direct message to that person. So somebody who likes coffee, you can send them a direct message. Which kind of coffee do you like? Decaf or caffeinated? What's the point of decaf? I don't know. But decaf or caffeinated coffee, you can respond to their message. You can also report a message. So if we definitely want to work together to make sure that this is an accountable and safe space. So if there's a message in the feed that's causing concern, you can report that message and it will alert a member of the NTTAC team. Also in the events feed space is where you will find event polls. And we will launch event polls throughout the summit. We want to hear how you're doing, how you're feeling, how things are going for you. So keep an eye out for event polls. Next to the event feed icon is the feed leaderboard. This is where you can keep track of engagement points that you have received. You can also learn how to earn more points. And just know, the more you engage with the platform and the more that you engage with other attendees, you will increase your chances of winning a prize. And we have several prizes that we're offering the audience. Okay, so now let's move down to some of the in-session features and icons. We're rounding the corner. We're almost finished, y'all. And I hope that you're still with me. If you're still here with me, I want you to post a message in the chat, not the event feed, but in the chat, I'd like you to say, I'm here. Just write that in the chat. You may notice that when you try to write in the chat, the leaderboard is covering the in-session chat area. You have to click that X button to close down the leaderboard or close down the event feed so that you can see the in-session features. So make sure that you do that. I see Michelle's here, Jessica's here. Let's see who else is here. Wanda is here. Awesome. Robin, good to see you. Candy. So this is how you communicate with people in the session. That's an important distinction, that there's an event feed and then there's an in-session area and the feed will cover the session chat until you close it and move it out of the way. Okay. All righty. So also in the in-session features that are available underneath the chat, there's a Q&A area. This is where you can leave questions for the speaker about content, okay? Please reserve questions about technical difficulties or challenges with the system by leaving a direct message to my colleagues Yasmina, and her name is spelled on the screen, Yesmina, or to my colleague Carrie, Kari. So if you're having issues with the platform, send a direct message. The Q&A is reserved for content so that the speaker can keep track of the questions that are being asked. Okay, so there's lots of ways to also engage with questions that are in the Q&A. You can upvote questions. So I'm going to ask one of my colleagues in the audience, maybe Suki or Michelle, to put a test question in the Q&A. And you can upvote a question. And that's another way to gain engagement points. So that's just another way to engage. There's also comments that you can make on questions. So lots of different options there in the Q&A. Alrighty, I'm going to zip even faster now because we have lots of great things to talk about today. Okay, there are also in-session polls. We will test that out in a minute, so you'll see and be able to experience that. We also, I want to make a very clear distinction about how you experience keynote sessions versus how you experience concurrent or breakout sessions. Okay, so in the concurrent session and breakout and keynote sessions, they're basically the same thing. The icons show up in the same way. For our friends who are here that want to experience the summit with the Spanish translation, you will click on that puzzle piece and it will prompt open some steps to start the live Spanish audio translation. Also along the bottom of the screen, there are emoticons where you can like things, thumbs up. If you are appreciating and liking this quick walkthrough, if you could give me a heart, I would appreciate that. That way, okay, thumbs up. Oh, I feel special. Thank you. The difference between the experiencing the keynote and experiencing the breakout sessions is really one thing, and that is the survey. When you go into your breakout groups, those concurrent sessions that are happening a little bit later, you're going to see an icon that has a square with some checks on it and a line. That's where you take your in-session survey. It's 3 questions. It's quick and easy. It's in both Spanish and English. So that's where you'll take that survey. Now for the keynotes, where you'll take that survey and have access to that survey is on the reception page or that home page. And there's a green wheel and it has Summit Feedback Survey. That's where you'll navigate to take the post survey. And we appreciate your feedback because we use it to improve upon our summit every year and really every day. We were looking at survey results from yesterday to help us plan for today. So please be sure to take the keynote survey and also the concurrent session survey. All righty, we're running out of time here, so I just want to make a quick note that the wellness room is available from 10 a.m. Pacific to 2:30 p.m. Pacific or 1 to 5:30 p.m. Eastern today and tomorrow. If you need space to decompress or relax, there are members of our NTTAC team there that will be more than happy to see you. And there's some really great activities happening like journaling and animal camp, some great things happening in the wellness room. So please be sure to check that out. The partner booths and the lightning talks that can be found on the booth section. Uh, Really quickly, the lightning talks are pre-recorded sessions. They're 10 minutes or less where you can hear from your peers across the country sharing stories about the system of care in their part of the world. All you'll need to do is click the play button in the middle of the image and it will play the video that's there. You can share your email address with the speaker of that lightning talk. You can also post a public message, kind of like the timeline for the booth. You can post that as well. Lastly, you can also be notified when the speaker is there at the booth. They've been invited to join throughout the summit, and you can be notified when they're there in case you want to meet them at a table and have a conversation with them. Okay. Woo! That was really fast. Again, the orientation is available. I am going to stop sharing my screen, but I also want to share with you all two other things. So I just said woo. There's a dog that's also saying woo. My friend Bridget, can you? There we go. So that was a long way around the block. I want to let you all know that occasionally we will share announcements like this, and it will show up on your screen. There's another type of announcement that will show up at the bottom right hand side of your screen. Um, and right, and it says it's kind of tiny, but it's there. It says acknowledgments are up next. So you can look in those two places to see announcements that are happening in the session. Sometimes they'll have links for you to click on. So just keep an eye out for those two announcement types. With that being said, I am going to pass the mic to my colleague, Don Yazzie, to talk to us and honor us with her presence as we honor Indigenous and Native people in the land.
Hi everyone, I'm sorry for my background noise. I had to run and find some internet, so I hope it's not too distracting. But I just wanted to introduce myself very briefly. My name is Anyazi, and my clans are Yaden and Tachi.
Hi, Don. I'm sorry. I needed to mute your mic. It's very difficult for us to hear you. In fact, we can't hear you at all. What we will do instead is that we will record your words, your powerful words that I know you have prepared for us today, and we will also make sure that people have access to that recording. In the meantime, I do want to honor and acknowledge that we have the Native Land Digital website here where you can visit to learn more about honoring Indigenous land and Indigenous people. We owe a great respect to them. And also, we have several presentations that will be highlighting speakers. And I am uh, trying to readjust really quickly. And thank you all for your patience as we readjust for just a second here. But while we are readjusting, you can visit this Native Land Digital website. In just one moment while we readjust. Okay, so Bridget, if you could, we can put that down. Thank you. All righty, readjusting. That's okay. All right, so I want to also make sure that we all are on the same page about the space and the environment that we are creating. We are creating an accountable space. And Bridget is going to share with us a link where we can access this. I'm going to read through this accountable space commitment, but you can also follow along by clicking the link in the button. As an attendee of this summit, we ask that you join us in committing to making this an accountable and welcoming space. In all places where we convene, we seek to create an environment that supports brave conversations, conducted with the highest levels of integrity, respect, and professionalism. Uh, on this journey together, we pledge to foster a welcoming, inclusive, and equitable environment and reject discriminatory, derogatory, oppressive, and violent language, behaviors, and actions. We agree to stand firm in challenging any breaches of this commitment through direct and kind communication. We uplift behaviors and actions that support the creation of spaces that are positive and welcoming for everyone, regardless of identity or background. The only way to make lasting change, really truly, the only way to make lasting change is to ensure that everyone is heard, respected, and safe. So if you all can please let me know that you are in it to commit to this accountable space. Please give me a thumbs up, hands clap. Thank you, and thank you. And I would also like to welcome us all to take a moment of silence. A moment of silence for those who have lost their lives in mass shootings, lost their lives to police violence and brutality, and those who have lost their lives to an unjust system that has repeatedly caused harm to children, families because of their economic status, their ethnicity, their sexual orientation, or their geographic location. So let's all take a moment to reflect on this. Thank you. Thank you for sharing that space with me. Um, in light of, well, really in sadness that we are experiencing so many mass shootings across this country, we have made an adjustment to our schedule today. We are offering a facilitated conversation titled From Tragedy to Healing, a community discussion on mass shootings. And we welcome you to that space to speak with some of our experts on our team to talk about how mass shootings can be addressed in our communities. That will start at 11:30 a.m. Pacific time, 2:30 p.m. Eastern time. And again, I want to remind you all, if at any moment you need to decompress or take a step away, I welcome you to take a step away from your computer, to turn things off, and to also utilize our wellness room where there are members there that can help you decompress. Okay, this is the slide that I wanted to show earlier that highlights some of the speakers across our agenda who are Native Indigenous peoples. And so we have a lightning talk. We have one of our keynote presenters today, and then also a session on May 11th tomorrow. So we invite you to please not only honor Indigenous people with your words, but also with your actions and learning how we can all support those communities and be a part of those community discussions. Okay, I am now going to pass the mic over to the co-director of NTTAC, Tracy Levins, to provide some acknowledgments.
Good morning. Thank you. Sorry about the lag. Good afternoon to our friends on the East Coast. Good morning to those of you joining from the West. My name is Tracy Levins. I am the co-director of NTTAC. That's the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. Thank you all for joining us today. And thank you for bearing with us with the technical glitches and as we learn our way around this new platform together. So thank you all very much. I am honored to welcome you all to NTTAC's 2023 System of Care Summit. This summit is the culmination of months of planning by NTTAC team members from 7 different partner organizations, all under the exceptional leadership and organizational skills of Ashley Singleton. So let's just show Ashley a little bit more love as we welcome into this space. We come together this week representing 54 U.S. states and territories and multiple countries to celebrate National Children's Mental Health Awareness Day and to explore the theme of this year's summit, Better Together, Building Systems That Care. The last few years have been challenging for children, youth, and families with mental health needs. The COVID-19 pandemic underscored the importance of designing, developing, and delivering services for children and youth who experience mental health challenges. This year's theme emphasizes the crucial role that systems of care play in supporting children, youth, families, and communities. As co-director of NTTAC, I am privileged to work with a dedicated team of individuals who are committed to improving the lives of children and youth with mental health needs. Together, we strive to create a system of care that is family-centered, youth-guided, and culturally responsive. We believe that a system of care is not just a set of services and supports, but it's the collaborative approach that involves many different voices and interest groups, including youth, families, providers, peer support specialists, policymakers, and advocates. We all play important roles in ensuring that children and youth have access to high-quality, evidence-informed, community-defined services and supports that meet their unique needs. As we talk about building systems that care, it's important to acknowledge that promoting justice, inclusion, diversity, and equity is a critical piece to creating effective systems that care. We must work together to eliminate disparities in access and to ensure that our systems of care are equitable and just, and that they provide opportunities for all children and youth to access mental health services and supports that they need, regardless of their race, ethnicity, gender identity, sexual orientation, ability, or socioeconomic status. Furthermore, we must prioritize the inclusion of youth and families as equal partners in the design, implementation, and evaluation of services. Their voices and perspectives are critical in ensuring that the system of care is responsive to their unique needs and experiences. In addition, promoting diversity and inclusion in our workforce and ensuring that our service delivery is culturally responsive is essential. By doing so, we create environments that not only respect, but also value the unique experiences and perspectives of each individual. In short, promoting justice, equity, diversity, and inclusion is imperative to help us create a system of care that truly meets the needs of all children and youth. As we come together for this year's System of Care Summit, let us each, as individuals and as a collective, recommit ourselves to these principles and work together to create a brighter future. I urge each of us to embrace this year's theme and focus on the importance of working together to create systems that care. So let's use our time today and tomorrow to share our experiences, exchange ideas, learn from one another as we work towards a common goal of addressing mental health needs and promoting wellness for children, youth, and families. Together, we can create a future where every child and youth receives the care and support they need to thrive. Thank you all for joining us today, and I wish you a productive and inspiring summit. And now, in honor of National Asian American, Native Hawaiian, Pacific Islander Mental Health Day, it is my pleasure to introduce you to the Deputy Director of the National Asian American, Pacific Islander Mental Health Association, NAPIMA, Crystal Canare. Crystal.
Thank you, Tracy, and thank you, NTTAC, for inviting me to speak today and for all the hard work you do to really support the mental health of children and families nationwide. Again, my name is Crystal Canare. My pronouns are she, her. I'm a proud second-generation Filipina American, and like Tracy said, I serve as the Deputy Director for NAPIMA, the National Asian American Pacific Islander Mental Health Association, which is a nonprofit organization which supports the mental health and well-being of Asian Americans, Native Hawaiians, and Pacific Islanders nationwide. And I'll start using the acronym AANHPI moving forward for that. On behalf of NAPIMA, I'm excited to wish you all a happy National AANHPI Mental Health Day, a day NAPIMA and community partners advocated for in Congress in 2021 to center and celebrate the mental health of AANHPI communities. National AANHPI Mental Health Day serves as an important reminder that our work in destigmatizing and improving access to mental health care is so important, especially in communities of color. The AANHPI community is among the fastest growing and most diverse racial groups in the U.S. And yet, according to SAMHSA's National Survey on Drug Use and Health, Only 23% of AA and HPI adults with a mental illness were able to receive treatment in 2021, the least out of any racial group. More alarmingly, from 2018 to 2020, the CDC reported suicide as the leading cause of death for Asian or Pacific Islander youth, ages 10 to 24 years old. For those who have followed this statistic in the past, it used to be 15 to 24, and now is expanded to younger youth. And I would be remiss if I did not mention the mental health challenges that have been exacerbated by the pandemic. The rise of anti-Asian hate, gun violence, like the most recent shootings in Allen, Texas, to longstanding racial discrimination, historical trauma from war, colonization, displacement, I could go on. And so it is more important now than ever to offer our support and resources for these communities. So this AA and HPI Mental Health Day, I honor our children and families and the hard work we do to build systems that care. I'm excited to share that Congress has introduced the national resolution yet again, for the third time in the House of Representatives and for the first time in the Senate. We have mental health advocates from 37 states, cities, and counties that have submitted proclamation requests for the first time this year. The states of California, Colorado are yet again celebrating, and the states of Michigan and Illinois have approved these state proclamations for the first time. And cities throughout California, Dallas, and Washington, D.C. are celebrating as well. So I invite you all to celebrate with us. Join us online. Use the hashtag AANHPI Mental Health Day. It's being used throughout various social media. Panda Express is having a national fundraiser for us today at any Panda Express if you order online. And I encourage you to go on the website that's in the resource pod. There are various in-person events taking place today and throughout this month, virtually in person, across our various organizations, our various 85 community organizations partnering with us today. And I'll end with, change doesn't happen in a moment, it happens in a movement. And so I thank you for moving with us together to build systems that care. Thank you.
Thank you so much, Crystal. And I love that Panda Express is supporting you with the fundraiser today. So let's all go out, order some Panda Express, and support Asian American Pacific Islander Mental Health Awareness Day. It's now my pleasure to introduce you all to Dr. Emily Lickvar. Dr. Lickvar is the Chief of the Child and Adolescent Family Branch at the U.S. Substance Abuse and Mental Health Services Administration, SAMHSA. Thank you, Emily, for being here. I'll turn it over to you.
Thank you, Tracy. Good morning and good afternoon. My name is Dr. Emily Lickvar, and I am the new Chief of the Child, Adolescent, and Family Branch in the Division of Prevention, Traumatic Stress, and Special Programs in the Center for Mental Health Services at SAMHSA. Many of you know me as a longtime government project officer in the branch. Yes, I have monitored 63 Systems of Care grants from start to finish, and even more so in between. I have worked closely with you, provided TA on SAMHSA deliverables, listened to the challenges and the triumphs that your communities face, and have learned a tremendous amount from you on our monthly calls and site visits. Coming off my 7.5-year tenure as a government project officer, I feel ready to lead this branch and honored to serve as chief. Please know I am bringing my lessons learned from the grantees into this role. I look forward to continue to work with the Systems of Care community and beyond and bring the branch's mission to fruition. As the Systems of Care guiding principles state, let's continue to strive to increase access to treatment for all children, youth, and young adults, deliver high-quality services through the use of evidence-based practices, infuse youth and family voice in our work, be culturally and linguistically competent, maintaining an equity lens, use data to continue to improve our programs, and work across agencies to build bridges and close gaps. Finally, on behalf of SAMHSA, I want to thank you all for being part of the Systems of Care community and being here at this Awareness Month event today. Back to you, NTTAC.
Thank you so much, Emily. I think now we are going to ask Neil Horan to join us on stage. Okay, it looks like Neil might have fallen off. So next up, we're going to move into our opening keynote. And so it will be my pleasure to step into Neil's shoes for a minute until he gets back on and introduce all of you to Angie Williams, Raquel Aviles, and Brandon Johnson, I think. I can't really see it from, Jones, sorry about that. As we hear their presentation about building a system of care in a rural community. So I'll turn it over to y'all. Angie, Brandon, Raquel.
Yes. Good afternoon or morning for some folks. Hope everyone's doing well. There were some questions that we were going to get teed off with to get started, I believe. I will pull those up and I'll throw that in until Neil joins us here in 1 second. Do you want to do a quick round of introductions before we get started? There's Neil. There we go.
Folks, hi.
Hello, Neil.
Make a big grand entrance. You know, I saw that Wanda was talking about the technology. I was putting away my flip phone, getting my flip charts, and okay, ready. So I'm really ready now. So really sorry about that. I'm super excited. So we're joined here, and we're going to spend the next about 40 minutes talking with folks who've really built brick by brick. See how I worked the title in there, guys? That was pretty smooth. We also have somebody who's going to sort of graphically illustrate. So we'll take a little breaks in between. But what we're really going to do is have a little discussion and really hear a bit. And I can distinctly remember 20 something years ago on a site visit in Wyoming thinking, this might be a rural part of the country. And I wonder how they may face challenges that I face growing up and living on the East Coast or not. And so I want to spend some time with y'all today, just hearing a little bit. And we'll sort of try and break it up a little bit. And we'll start with the foundation of the house and then see how that gets sort of turned around. But maybe you all can sort of start with this around why you think it's so important to talk about building systems of care in more rural or frontier kinds of communities. And it's sort of open, whoever wants to start.
Ladies first, go for it.
Raquel, how
My
about you?
name is, hello. My name is Raquel Aviles, and I'm a tribal member of the Pascoyaqui tribe, Los Enchiñavo. And we were recipients of the Circles of Care planning grant back in 2001 to 2004. So our tribe actually had the opportunity to gather the voices and stories of our community members and those children and family that were in the behavioral health system. And for that time, really dive into the system of what we currently have, what they wanted it to be, and what we can incorporate to make it more culturally appropriate and sensitive to our communities. So over those years, you know, we build relationships with our community members, our providers. We did a lot of needs assessments with our community, and during that time, we were able to actually build the system of what our community wanted. And that was very important at that time because things were happening in our community where they were going to tribal leadership and letting them know, you know, what are we doing to help our families? What are we doing to help our youth? And we were providing services, but not all families wanted those services. So it felt like a cookie cutter type approach. So a lot of families would start and stop. And, you know, there was a lot of voices out there saying we need something different. This isn't working. Maybe it works for some, but not for others. And because we were in a rural community, a lot of our providers had to wear multiple hats, just to fill those gaps and use the resources they had to meet the needs of the community. So it's very important to, with that foundational work, to go to the community, go to the providers, see what you have now, see what's working, and build upon that. And then you can identify the gaps and seeing which direction you need to go and which who's missing at that table when we're talking about building the foundation and the blueprint for our house, the brick by brick. What are those rooms that you need to build, and who needs to be in those rooms? Who needs to be at that table? So that's what the metaphor, we wanted to talk about, because it's a process. It's a process, and it's not something that, oh, I have a program, it's going to solve everything. It's really building that concept of a house with your community providers and your partners. So I'll pause there.
No, it's great, Raquel. I mean, I stopped listening when you said cookie. I'm just joking. I really like the way that you laid that out for us. The idea of that one sort of aspect that you have to think about is that providers may wear multiple hats. I think that those concepts are really important to think about for folks who are either sort of addressing where their system is or where they want it to go. And there are several things you sort of mentioned there. I want to see Brandon or Angie, where do you want to jump in? Angie, you want to jump in?
Good morning, everybody, and good afternoon, everybody. My name is Angie Williams, and I am representing for Aspire Behavioral Health here in Albany, Georgia. So I can say with us, the foundation of our organization to be a rural SOC was about engagement and connection. And one of our partners, he made this statement that was just so profound. Matthew Clay, he stated that we have to connect before we correct. And let me say that again. To us helping professionals, we must connect before we correct anything that happens in our communities. We hear people say all the time that they don't care how much you know until they know how much you care. So that is the basis of what we're doing here, because so many of our families in the rural communities, they struggle with feeling connected and a part of a supportive system that cares about the things that they care about. So our desire here at Aspire Behavioral Health is just to let the family know that we care. And we are here to help them to overcome those barriers and those obstacles that just keep them in that place of feeling like they're not enough, they don't have enough, they're not worthy enough. And we know that that trickles down even to the children. And because we work with the youth and young adults, we see this on a daily basis. So if we could have that foundation of, I like this title, Better Together, building systems that care. Again, if we can let people know that we care about them, we can help move them along from a place of just surviving to thriving.
Mm. Angie, I love the thread that I'm already sort of seeing around these connections. We're going to come back to this. I have a sense, also because I know we're going to come back to it, but I'm trying to pretend it's all spontaneous. But this idea of like this connection, and Raquel, you talked about that really nicely, about there's not going to be a lot of movement without sort of listening, connecting, things like that. So Brandon, how about for you?
Absolutely. Greetings, everyone. My name is Brandon Jones. I'm the executive director of Minnesota Association for Children's Mental Health. And if you know anything about the state of Minnesota, we have our big, large metro area, which is St. Paul, Minneapolis. But outside of that, we have Rochester, which is kind of a, town city. We have Duluth, and then it's just a bunch of rural areas. So we do a lot of connecting to rural spaces. And to tie into what Raquel and Angie were saying, relationships are key. We know that relationships get things done. And in order to build those relationships, to build those connections, we have to be consistent, persistent, and patient. So the consistency is you got to show up, you got to get there, you got to meet the demand and understand the cultural dynamics within various different communities. Just because they have a title of rural does not mean that they're all the same. And you can have two rural communities that are in the same county that are very different. So it's important to understand the cultural dynamics that are at play in all rural communities, and how do and what do each one of these cultural dynamics want? What do they need? What is their ask? And how are you going to build that connection and show that you care to meet those demands? It's very, very important. A lot of times when we hear culture, and especially in the United States, our minds go to race and sometimes ethnicity. And when you're working in rural communities, that's not always the primary factor. It is something to still pay attention to, but you have to understand the culture. How do people interact? How they engage? What is their expectation? What are the religious factions that are in this space as well? So we have to be able to, when we're working in these spaces, really understand the cultural dynamics that are at play when we're building these relationships.
Mm. Really important point, Brandon, because I think that in addition to, right, so it obviously race and issues around equity and diversity and inclusion are key. I think your point is really important, that we have to think about this as a whole. What are the issues that we're trying to deal with? I'm just a little stunned because I'm taking 2 pages of notes on all the sort of key phrases and the love that you got. I don't think you're able to see the chat. I'm tracking on it. I also encourage folks, ask questions, and sort of keep going in the chat. But you are getting a whole lot of love in there around sort of the ideas that you've been laying out around relationships, get the job done, about the cultural dynamics that you just talked about. So I'm gonna take a little break, and I wanna just leave a little space here for how this is being depicted in a more visual way, because I think everybody has a different learning style. So let's just take a little break. You guys grab some some liquid, and we're going to turn it over for our graphic illustrator. Okay, so for folks, hopefully you can see, and I know we have a little work still going on there. So I'm going to give us, just folks, I mean, I love the sound of my own voice, but maybe we'll just let it sort of sit for a sec. Just a reminder for those of you, it's a visual. So there's no talking. It's just going to be something to see. Okay, great. Well, hopefully for all of you, one, just having some illustrations of the three of you is kind of cool. If we could pull it up one more time, just to sort of show folks, and I can just walk through it for folks if anybody has a visual impairment or anything like that. Thanks, Jan. Great. So we have sort of our concept of brick by brick. Why is it important to hear from rural communities that this is, building this structure as a process? A couple of pictures of the hats about the point that Raquel made, that in Pasquayaki, our providers wear many hats. Um, Brandon's point around understanding culture in rural spaces is key, about religion and different values and things like that. I think folks are going to remember Angie saying we have to connect before we can correct. And Brandon saying relationships get things done. And of course, Raquel started us with we gathered stories to hear what works. And that's a great way to sort of illustrate this for folks. If you get the full screen, obviously it makes it easier to see. But just wanted to make sure that folks are sort of tracking with us. So we're going to sort of break in every so often in our conversation here and sort of check in on how it's looking visually. Part of that, I think, is just because of having to look at this is not really a good thing for anybody for too long to look at my face. So it's all good. Good. Glad folks are liking that. Hopefully you'll sort of get to figure out the full screen. I know there's a lot of technology going on, and appreciate people's patience with us. So we sort of talked a little bit about building the foundation of the house, getting started. And I think, as you all sort of laid out, it was not simply, okay, we have a grant, or, hey, good news, we know how to build a system. It was much more for all of you about starting points. And I'm wondering if any of you could sort of speak to how you did that, how you went about building relationships. Were there some that existed that were your starting point? Were there some that didn't exist that you were like, I really have to make that connection? And how did you end up making those collaborations? Because Raquel, as you mentioned, people wearing lots of hats. As I'm sure many are aware, in some rural frontier, more isolated communities or tribal nations or territories, there's not a lot of folks around. And so in terms of services and things like that. So I wonder if y'all could speak to how you went about this sort of, okay, we've got a foundation. Now what? What was the sort of, or some of those steps that y'all took to start to get to the next level?
I can hop in first
Thanks.
this time.
Great.
So for a few of the different projects that we've been a part of, we really tried to leverage relationships that were already there. And by leveraging those relationships, we ask questions. Is there any prior history of similar projects that have been done? What has worked? What hasn't worked? Is there any community trauma that has taken place? There's a lot of communities that feel like, organizations or even sometimes institutions parachute in, do some stuff and parachute out. and that leaves the community feeling harmed, and it's important for us to know those types of things and get that good context when we get started. The other thing that I want to say, and then I'll pass the mic, is that it's important for us to also ask questions and really figure out what does the community want, especially for organizations that are not based in those communities, and especially for organizations even further that are from metro areas, because a lot of times, since metro areas are usually resource rich, we sometimes have a savior complex when it comes to rural communities. And I think that's something that we have to keep in mind, that there may be some apprehension or a little bit of resistance sometimes when working in rural communities due to that nature. So it's important for us to check our kind of collective privilege and organizational privilege as well as we work within rural communities.
So before y'all others jump in, just there was a question from Jennifer in here about how you're defining sort of rural, and I'm not. Oh, sometimes I just snap my fingers and like a question just pops up right in front of me. So I'm going to go back to that cookie thing in a bit, Raquel. But what's the population size that folks are using to define rural? And I'd encourage folks to sort of throw in the chat as well what they think. But maybe some of you can sort of define what's the population that you've been talking about in Albany or with the Pasquayaki tribal nation, things like that. So Melissa's saying 1,000 or less. Raquel,
Well, Yeah,
What do you
for
look
us, we talk about our federally recognized reservation, and not only tribal members live on the reservation, but they live in the city and other communities. And we want to provide and be available to all tribal members. So it's hard for me to say this is our number. I mean, today we have over 22,000 members all over the country, and the Bosco Yaqui tribe is the reservation that's in the rural, southwest side of Arizona, Tucson, Arizona. And
Mhm.
people have to travel to get, services from the tribe. And we wanted to get input from other tribal members living off the reservation and in other communities, even in the Phoenix area as well. So our population, when we say rural, we're thinking, our tribal members and how we can provide similar, if not, different types of services off the reservation, because that's where we have our sovereign unity. That's where we're able to, have intergovernment agreements with the state, so we're able to bill for our services and things like that. But we can't do that off the reservation. So when we have to think about sustainability, we have to think about who we're reaching and who is willing to drive to the reservation versus meeting them in the city.
Yeah,
Hope
Raquel,
that
I love how this important point that you're making about, you're a sovereign nation. And so in terms of how things get defined, they get defined by you, right? This is a the equivalent of another country, to put it more simply than it really should be. But I love this idea that you have to think about this as sort of your enrolled membership as sort of a population. Um, so, Brandon, I know you've been putting in the chat, because in comparison, you're working sort of at a state level, and Angie's at a community level. So, Brandon, you want to talk a little bit about what you were throwing in there?
Yeah, I know I've seen that number before, so I had to Google it quickly. But the USDA Economic Research Service typically defines a rural area as a city or town, or not a city, sorry, a town or a place with 2,500 people or less. Now in Minnesota, we have communities that are 3 times the size of that, but are still considered rural areas. So I would probably say maybe 10,000 or less is probably a good marker for that. But it really depends on the state and how the state's organized as well. But that's kind of where I would say as a rural area.
Yeah, I think you get some agreement on that from Rick from Alaska, who has a totally different right? They have some very different definitions of how things look when you're talking about a state like Alaska. But I think it's an important point, Brandon, to start to think about that. I mean, there are federal definitions of this, but it's also about, you're seeing in the chat things like maybe it's isolation and distance from services, as somebody mentioned. I think folks are asking, is it measured by a specific population, relative size? I think there are a lot of factors, and I don't want to sort of make this session about sort of the definition. I think it's more about the fact that systems being built in some of these places. So I appreciate taking that. Angie, what are we talking about in Albany?
Well, I can tell you that we don't have a Panda Express.
Well, maybe somebody can order it and get it sent to you. Big delivery fee, but we'll see what we can do.
So our rule, again, just like what everybody is saying, that sometimes we are just so secluded in this area. Even though I am here in the city part, we have outlying counties that don't even have transportation like we have here in the city of Albany. So transportation is a huge barrier for a lot of our families in our communities. Also, even just with us traveling to the next county and don't have phone service. So these are all things that we are, kind of dealing with in our rural areas, that is just means of services, because even depending on what the situation is for the family, we travel three plus hours to Atlanta to get other services that you would think we would receive here in the Albany area, but we don't.
Yeah, Angie, I see Brandon and Raquel shaking their heads about we have to travel 3 hours sort of piece.
Yeah.
anything else you two would like to throw? Because that's one challenge that I think I've already heard, and I think it would be great to hear. Not great because it's not a really positive thing, but to hear a bit more about some of the challenges in building your system um, that you've experienced, Raquel, Brandon, and Angie. Obviously, I'll come back to you.
I was just going to mention the need for capacity building. When we heard back from our community, they wanted to see more tribal members providing services. So during the circles of care time, and we did it when we got the systems of care, was bringing those trainings to our community members who are wanting to be like peer support, wanting to be more advocates for their own children. So they wanted to see more tribal members. So we really focused on how can we build up those skills, and our community coalition that were actually helping us plan the system, they were receiving like wraparound training. They were getting educated on how services are going to be, conducted, so they could let providers know this is how we want to be spoken to. We don't want case managers, we want prevention coordinators. We want, parent mentors. We don't want to be labeled. So it was really going to the basics of that and asking the community, how do you want services to be provided? What type of training do you want maybe non-tribal providers to know about? What kind of cultural awareness they need to know? So it's really, gathering their voices and hearing, maybe not the so good stories too, and how they felt the system has failed them, and really listening to the complainers, or those that are never satisfied, the labels that they were getting because they were voicing, their frustrations. So it was a hard job, and it is a hard job when you go to that community level and really just listen, what is really happening. And it's a challenge. So it's not all, butterflies and roses and everything, because you have to hear the bad in order to make the good happen.
Mm-hmm. It struck me when you said that, Raquel. I think it was Evelyn made a comment earlier on about nothing about us without us, and this idea of like, why would we have providers who are not of our community, right? The whole idea of even in rural communities, we can't just sort of say, well, I got to drive 3 hours. It's got to be about how do we build our workforce. So, Brandon and Angie, any thoughts about some of the challenges, and maybe there's no challenges, or maybe the challenges that you've been able to address?
So I can say for us, Raquel was just spot on, even with us being here in Georgia. I mean, we had to tackle this one relationship at a time. I mean, we literally had to learn about every meeting, every coalition, every collaborative, and start attending as many as possible just to get to know our community partners. We had to knock on doors and ask for meetings so that we can know, once again, our community partners and how we could meet the needs, not only for our individuals that we were serving, but for our community partners as well. I can tell you this, that we have an amazing executive leadership team, and our CEO, Dana Glass, and our Deputy Director, Lisa Osterving. These ladies stand on the foundation of being solution focused. I can tell you that no is not in their vocabulary. If it was a way that we could meet the need of the community, they came together, they developed a plan, and we met the need. So a lot of times, we didn't sit around and put the ball in somebody else's court. We hear this statement all the time: we need to be the change that we want to see.
Mm-hmm.
So this is what they did. I mean, again, we were just in a place, if we didn't have great relationships, just like Raquel and Brandon said, sometimes things were not so great. And if we did not have those great relationships previously, it became our goal to strengthen the relationships in our communities with our community partners, because at the end of the day, if we work together, all of us win.
Mm. Did you mention their names because you're trying to get them to get you Panda Express, or because they were really helpful? I'm just checking. All right, just making sure. Brandon, I know you wanted to jump in there.
Yeah, I think there was a little bit of both there. I'm getting hungry. The other thing that I think that is a gap that I think we have to be very mindful of and somewhat sensitive to is I know during the pandemic, a lot of the focus was on telehealth and being able to give that access. And a lot of rural communities did benefit from that. But there are communities that don't have that level of technology or that level of range of access where they are not, I don't want to say shut out, but they have to almost transport themselves to an area where they can utilize that telehealth as well. And I think we have to think about how do we expand the broadband and the internet access for those groups so that they can have that. You know, Angie, you mentioned something earlier about phone services not being able to reach particular places. That's a serious concern for folks who are relying on their, you know, behavioral health services to come via technology. So that's something we also have to keep in mind and advocate for when we talk about legislation and budgets and things. Is how do we expand that access across the entire states and entire counties?
Really, really, really important points that we can't just sort of. And I think if we go back to where y'all started around, um, listening to the voices of the community, part of that is also being cognizant of some of the challenges, some of these gaps you all talked about, but also starting to think about what are some of the solutions, both technical and adaptive, that we need to be thinking about. We have a couple of questions. I'm gonna hold off. I'm gonna come back to them because there's a couple things that got brought up. I want to hear, just to give you guys a chance to take a breath and to be ready when we come back. I want you to start to help us understand how youth and family voice, how youth and family are driving systems development in your communities, states, tribal nations. Um, and I want to hear a bit more about stigma. I think this is a big piece, and wondering if in your experience that's been a bigger issue, smaller issue kind of thing. But I want to turn to our illustrator, our visual, and just sort of sit with it for a bit. Remember, there's directions on how to make your full screen so you can see it, and then I'll also take a second to describe once it's up. Say. So give folks a minute here for those who are looking at it, and then I'll sort of describe for folks who may not have access. It might be too small, maybe some other issues. So I see in here sort of this idea about listening to those being served. Raquel did this really amazing job of sort of reminding us that we have to sort of provide training and develop our own workforce, and not sort of keep looking to others and making them wear lots of hats, but sort of thinking about cultural sensitivity, and also about sort of the cultural sensitivity of non-native providers. The idea that folks that you gathered stories to hear what works has continued to sort of be a part of this house that you built, that you don't parachute in. And I think that was a big, that sort of set some folks off in the chat, not sets them off in a bad way, but just really got people jazzed up about how to sort of think about that, and how that sort of perpetuates some of the things that really are not, that don't work well in our systems. We talked a bit in this section about the definitions of rural and what the isolation and things like that, and really thought about that asking and listening that continues to be a part that I think for some think, well, it's a small community, whatever the numbers were that we sort of agreed on, but it's small, it must be easy to ask and listen. But I think what I'm gathering from you is it's no different than anywhere else. You're doing the same kind of work. There are some challenges that may not be the same if you live in a large city, or a particular place in the country. But I think that this illustrates for folks a little bit about how critical it is that this work really be about listening to those being served. So I want to come back to this. We'll take this down, and just for folks who are, so I'm sort of fine with things, as my friend Roxanne Kaufman would say, loosey goosey, Miss Moosey. But I know folks are like, it's 220. 220 is when We're going to go a little bit later. We'll all make up the time, I promise, and there'll be a little announcement. But we'll probably be about 10 minutes over the time that we thought or so, and I'll try and get us tight. But to that point around sort of listening, I wonder if you can, if y'all can talk a bit about your experience in more rural frontier areas, really being family and youth driven, and what that's looked like, and how that's been incorporated, and whether you felt like, well, all stories I hear about trying to do that, it's so hard and it's so easy here, or everybody talks about it, I have no idea. So can one of you talk a bit about what's happened for you in Pasquayaki or Minnesota or Albany?
It was hard. I think the first year of starting the Circles of Care project was building that trust. Community members saw this was another program that's gonna hype us all up and then go away. Like, why should we talk to you? Why are you different? What's gonna happen after I, share my information, my stories, my concerns? What are you going to do with this? So for the first year, it was building that relationship with community members in general, that we want to know what is a healthy Yaqui person, what's a healthy Yaqui family, what is culture to you, like going back to basics and just asking that. And then they slowly started to see, oh, you want us to speak, you're not telling us, you're not guiding the conversation, you're actually wanting to hear from us. And even in myself as a facilitator, I had my agendas. I had 10 minutes here, 10 minutes there. We're going to go through all this. Sometimes the elders would take over the whole meeting and say, we need to talk about this. We need to talk about what is respect. We need to talk about, how our children's condition is right now in the community, and how we're not, we didn't have therapists back in the day. We came together as a community, as a family. We helped and supported each other. And I had to shut up and I had to, listen to their stories and take notes. And then, almost like the artist is doing, go back and like design. Is this what you are saying to me? Is this what you're telling me? And we would go, no, that's not it. We start all over again. So it is a process. And once everybody is in harmony, and it's beautiful. I can tell you meetings where, youth spoke out about being labeled and hate being labeled, and elders jumping in and saying, you are not your label, you are not your diagnosis. And beautiful things have, came from that meeting, and we were able to design, wellness models, and define, what does it mean to feel lost, but you're on your journey, and get tribal language and words and symbols in those concepts. So it was the most difficult thing I ever done, and it was also the most beautiful thing I've done. So it is work. It is work, but it's worth the work.
Well, and I love that you didn't sugarcoat it. You just immediately came out and just said it was hard. And I think that at least acknowledges for folks that, despite the fact that you are being showcased at a national level, it was because of some of that work. And the thing that you said that really struck me, that sort of makes me think, isn't that really what we're trying to do when we're trying to help develop a system, is to figure out what it means to be a healthy Yaqui person, a healthy Yaqui family, for each person, not just, hey, we got a system with some services, which I think, Raquel, is what you've alluded to a couple of times, of good news, more stuff coming your way that we're going to just impose on, like that. Your sort of building of this house for Pasquayaki has really been about, it's our house, and everybody's room in that house has to sort of look like what they need it to look like in order for it to be a functional system. So I love the way that you've laid that out. No pressure, Brandon and Angie, but let's see if you can top that. I'm just joking.
Well, I just wanted to say, and I love that analogy, because when you think of a house, and you have a solid foundation, you have a foundation, but you might just want to do some renovations. You don't tear down the whole house. You just do the renovations. And once you do the renovations and you see that there's still something that's not in place, you might build on. So that is what we have done here at Aspire. We're not tearing down the foundation. We're still using the foundation, but we are doing things different and we're adding on. So with that being said, we have our we have like three of our best successes around identifying the needs of our community. And one of them in which is our Hope Project. And for the Hope Project, this is an initiative to bring all of the schools together, our Department of Juvenile Justice, DFACs, and other youth serving providers together to talk about the needs in the community and the ways that we can meet those needs. Again, if we can work together, things tend to be a little bit better. We also have what we call our PAC, Peer Led Support Program. And PAC stands for Promoting Advocacy and Connection. So, again, we're talking once again about connecting. And this came out of a desire to mentor, recruit, train, and hire those parents and those young adults with lived experiences so that they can share their incredible stories to inspire and promote hope for others. Again, our peer workforce is again growing and it's just amazing. One other thing that we are deeply rooted into is our school system. We have partnered with them to have some space at one of their locations, and it is not just Aspire with mental health, behavioral health. There are other providers from the community in this one location. So we call this our Family Resource Center. I call it the one stop shop because now we have created an environment for our families to receive any service that they need without having to get off from work every other day to receive these services, without getting the young person out of school every other day to receive services. If we can find a way to provide these services for our families all at one time, that's exactly what we're doing on this end.
Yeah, and what I really love about what you just laid out is that I think that for some folks, when they think about more rural or frontier communities, they think, well, they don't have and they're missing. And yet, what you just described is similar to Raquel, that you thought about. So, what do we have, and how do we build on that? And what does it look like? And how does it sort of? And there was a point made in the chat that I thought was really a helpful thing about sort of you have to maybe keep having those conversations every few years, probably more often, but at least every so often because definitions change, thoughts change, our environments change. So people are resonating with that idea of renovations that um, I'll just be honest. My mom's favorite thing to have at her house is a dumpster because she loves to redo that house. There's a dumpster in the driveway. It's a big day for my mom. But that idea of building a system is not just we built it and we're done. It's we've built some foundation. We've now made these connections. We're working with youth and family. The idea that Raquel, that you just laid out about what does it mean to be a healthy, yaki person. We've done that. And then how do we keep going? And what do we need to, maybe we got to strip that. Maybe that wallpaper is not gonna stay with us. So I love this idea. Brandon, how are you seeing this?
Yeah, I would continue on the idea and the metaphor of the renovation. When we talk about building systems of care, we have to remember what does the community care about, and really circle our efforts around that care. I've been a part of efforts where we came in and renovated houses and invited people back into their home, and they're like, "What is this?" They didn't want that, and I've learned from those experiences. And we've also one thing that we've also been able to do is really invite people to tell us how do they want things renovated. One of the strategies that we did in one of the communities here, they really rallied around the high school hockey team, their big hockey town. So we started to go to their games. Now, this wasn't a therapeutic intervention, but this was what the community cared about. So we had to build that trust, and we had to show up and be at these games. Now we got looks because they knew we weren't from around there. but we showed up to at least 2 games, and then we built a connection with that hockey team that had a lot of sway in that town, and then it opened up possibilities for us to make a connection. So it was kind of a backdoor way of working on building that relationship and listening to what that community wanted, but we had to know first what they really cared about. Now they cared about other things as well, but that hockey team was one of the lifebloods of the whole town.
Yeah, I love this idea of like, let's figure out what's wanted, what's important, and then we'll work around that and figure out how we do that. It's not, oh, well, I don't have that material, so I can't do that renovation. It's, I got to figure that out. So there's been there is a question that I had told you all I was going to come back to around the issue of stigma, and so I, if I could, I would turn into a big rectangle with purple around it, like that. So what are sort of the strategies that you all, I'm still using my flip phone, dude. Like I have no idea what's happening. So what are some of the strategies that you all are using to address stigma? And maybe we can even back up and talk a little bit about what stigma looks like in the places where you are. So I don't know who would like to start.
I'll start. A big and simple example, I think, of stigma back when we first started, and we were planning grants, so we weren't providing services. So I felt like, I wanted to give back and do little things that we could change. And one of the things is we used to have a trailer that said behavioral health services. And people said, one of the reasons why I don't like going is because they see me going into the trailer that says, mental health, behavioral health services. And so then we talked about like, well, what do you want it to say? And I go, well, we're going there because we want to be balanced. We want to be centered. So they changed the name to Centered Spirit Program, and we changed the sign Centered Spirit. So, that wasn't a big thing. We just had to pay for a sign, but the community loved it. Like, you listen to me, I'm not going to the behavioral health trailer no more. I'm going to the Centered Spirit Program. And that was a big switch in the way people thought about, going to behavioral health services. I'm going to be centered. I'm going for wellness. If my arm was broken, I go to the doctor. If I feel my heart's broken or there's something going on with me, I want to talk to a therapist. And we just flipped it around where we didn't, oh, they're going to the behavioral health services, or, we included them as that's a part of wellness and a part of being balanced.
Yeah. Noelle talking in the chat about how powerful language is, and just a simple, I don't know how much signs cost because I'm not allowed to use any money in our family. But the idea that the change of a frame for folks goes a long way. That's awesome. That's really great. Brandon, Angie?
I can say with us, I love that, Raquel, because again, we have to create the atmosphere for people to want to come. And if we are working at a facility that we don't want to be at, why would we think somebody would want to come to receive services? So I know I can speak for Aspire. Back in August, we moved into our new location. And our location now, it looks totally different from the last location that we came from. And when people walk in, I have the pleasure of saying, hey, we're not serving hospital here, we're serving hospitality. How about that? So again, creating the atmosphere for people to want to come and receive those services. And myself, because I do a lot of the community work, I'm out here in the community. My face is out here. I'm out here promoting that, hey, it's okay to not be okay. Somebody just need to know you're not okay. So just being consistent in showing up and talking about mental health, behavioral health, all of those things go together, and we need to deal with it so that we as a family can be whole.
Really, really, really great, Angie. Jessica in response said recovery oriented language, listening to understand, seeking to understand. And I think that sort of really good way of describing what you just were talking about. A lot of ups, a lot of positives for you, Angie. Brandon, I'll come to you, and then I'm going to bring our visual graphic up one more time.
Perfect. Yeah, and I'm just gonna echo both what Raquel and Angie already stated, but with the stigma comes a lot of shame, a lot of fear of judgment. Sometimes people even considering receiving assistance or help as weakness, and those things are all things that we have to use the power of language. We have to use reframes to let people know that it's okay to receive the services that are here. And I think that that's really the way. That's one of the main ways in, is by listening to the community, understanding their context, and being able to shift our approaches, and then also delivering kind of some of that mental health education or behavioral health education to the best of our ability. That's again relevant to the context of the communities that you're working in, and making sure that again it's something that they want. I think that's been the biggest learning opportunities that we've seen here in the state of Minnesota.
Yeah, no, I love that thought, Brandon. Around, I think oftentimes many of us who've been involved in this work are super excited. We got a grant, we've got something, we've got a cert, we got something. We don't necessarily always know that's what everybody wants. And again, if we're going to individualize and think about each person, each family, each youth, what do they want is a really important point. So let's bring up our visual, and I'm going to have just one quick sort of final word from each of you. So I'm going to give everybody a minute or so to take a look, to go full screen. So we've added quite a bit here. This is awesome. Thanks so much. So for those who can't see it, or would like a little description here, talked a bit about more about it's not just rural means one thing. It's about thinking about language, religion, values, understanding culture in rural spaces is key. We talked a little bit about how do we expand access through action and policy, and building that trust, which takes time to build. It isn't just, hey, we only have 3 years because that's what the funding is, but that doesn't matter. We have to take this at the pace that is comfortable for the folks that we are serving. And I think that word has really struck me today, that it's not about what we're doing in our community, what we're building, it's that we're all building this. Brandon, with his incredible hockey knowledge, really shared about the idea of we've got to show up where folks are and not just expect that they're coming to us. And then Raquel's just seemingly simple, but really in some ways sort of elegant way of saying we're just going to change a sign, when in fact it really changes how the system is viewed, is a really good sort of piece here around centered spirit. So love that. I love what you guys have been saying. So in our last minute or two here, and then I'm going to turn it back over to Ashley, who will sort of walk folks through where we're at. Thanks again for all that. Just maybe sort of a last thought around, so what should folks do? There's been a lot of great stuff in the chat, and I know you all have been focused on this, but what's sort of the last piece that you would say to somebody wherever they are? Maybe they're still building that foundation, or maybe they're struggling because they don't really know how to get. What's one thing that you would sort of leave folks with around where should they go next?
Well, I think you sort of said it when you said not about us, without us. And sometimes you need to like step back and see, you know, why you're doing something, or why something's going a certain way, and make sure that you invite the right people to the table and really listen. And that may mean sometimes you have to be vulnerable and share your story and experience, so they can see that you're there not because of the funding or the grant, but you're there because you want to make a lasting change, and that you continue on, and that this is just the beginning of the story of the system, and that it keeps on going. And here 20 plus years later, I'm still, talking about the story that started with the Bosco Yaqui tribe in 2001,
Yeah.
and you have to continue to share those stories, because it's not just words, it's heart, it's a soul, it's what people are sharing with you, and you need to carry that on so everyone understands the work that's been started from the foundation and the renewing of the home.
Mm-hmm. I love that, Raquel, the renewing of the home. That's great. Angie?
And I guess I can add, Raquel, that was just so good. My thing would be just consistency. People want to see us show up. I say all the time, somebody is expecting for you to clock in, somebody is expecting for you to clock out. And even though we might have some tough challenges on some days, but this is hard work, not hard. It is hard work. And this is what has kept most of us in the fields that we're in, doing the great work that we're doing, because we are so passionate about what we are doing, and we can definitely see the fruits of our labor.
That's great. Thanks, Angie. Brandon, last word.
Yeah, my final thing is to encourage sustainability, not just for the communities that we go into work in, but also for the folks who do this work, because it is hard work and it can be emotionally taxing. So how do we, keep ourselves whole and well as we do this work and as we go into communities and we see the needs, and we know that some of our grants are not going to achieve everything, but at least we've done something to help that community continue to move forward. Houses for the most part can be sustainable when they're well taken care of. And hopefully that's what we do when we go into community and when we're doing our own personal work at the same time.
That's great. I have to tell the three of you, one, how much I appreciate all of what you've put into this. I know that sort of carving time out, much less all the things that are happening in all of our lives, I just really appreciate your time. Ashley will tell you I rarely pay attention to anything, but I was riveted this entire time. I really started with the cookie thing, Raquel, that I didn't pay quite close attention. But I hope that folks got as much as I did. I've got 3 pages of notes, and I'm supposed to be facilitating. You guys have left us with a lot of sort of inspiration, a lot of sort of phraseology, I think, that can drive some of the work, not just in rural or tribal and frontier communities, but just systems work. So really appreciate it. Thanks, y'all. I'm going to turn it over to my friend Ashley. Slowly, I'm going to turn it over to Ashley. I like to make it dramatic.
Thank you, Neil, because I'm just over here talking away. You just going and singing praises. And y'all should have heard me. It was good. I was saying some good stuff over here, but I was on mute. Okay, so thanks again to our panelists. You all were phenomenal. You are phenomenal. Thank you, Neil, for moving us along. And Yen, thank you for the graphic illustration. Folks were asking, will the graphic be available? Yes, it will. Later today, we'll upload the graphic to the resource library. You remember how to get to the resource library, right? It's right across the top of the screen where you see reception, wellness boost, and then boom, resources. You will find the graphic there later today. We're also going to provide graphics for all of our keynotes. So we're taking notes for you, right? And making it colorful and beautiful. So you can find graphics for all of our keynotes after the sessions in the library. All righty. So like I said, we're shifting the schedule just a little bit, but we'll still be on time. We're going to take a 10-minute break from 2:40 p.m. Eastern to 2:50 p.m. Eastern. And then we will travel over to concurrent sessions or those breakout sessions. So hopefully you've already taken the time to look at the schedule, to pick and choose which sessions you want to navigate to. And just know that all of the sessions are being recorded and they will be available immediately after the session ends. So even this session, if you go back and check out the schedule, you'll see watch replay right there on the line of the agenda item. And you can watch it over and over again. And what's also really cool is even after the summit is over, you can log back into AirMeet and watch whichever sessions you like to watch. I also want to mention, and I failed to mention it earlier, that you can access resources. So a lot of the resources that Raquel, Angie, and Brandon referred to are already uploaded into this session. There are on the icons list 2 pieces of paper stacked on top of each other. That's where you'll click to find the resources that they referred to. That's also in the resource library. Okay, so we have the concurrent sessions, and then the keynote presentation for this afternoon starts at 1 p.m. Pacific, 4 p.m. Eastern. So lots of good stuff happening today. If you have to head out for and leave the summit, we understand. We know that you all are busy doing the hard work, right? But before you leave, I am inviting you all to please let's respond to what our speakers asked us today. You know, what are some innovative ways that you use to connect with your system of care partners? So if you could respond to that in the event feed, so not the chat, not the session chat, but let's respond it to the event in the event feed so everybody else that joins in later can see some of the recommendations that you have, some ideas and advice that you may have about innovative ways to connect with your system of care partners. Okay, I am going to end this session so that you can enjoy your break and get hydrated and ready for the concurrent sessions and breakout groups that will be happening shortly. Okay, take care.